This video is an introduction to hydrocephalus, so we'll discuss the pathophysiology, the signs and symptoms, and then the treatment. Hydrocephalus is usually a congenital problem, although it can be acquired due to injury or illness, but we will focus on the congenital version of hydrocephalus today. This image here on the page is a classic hydrocephalus baby with a significantly enlarged head and sun-setting eyes. This occurs in about 1 in 2,000 births, and it is often associated with other CNS malformations, especially a myelomeningocele, which you can find in the spina bifida video. To understand the patho of hydrocephalus, you need to remember that cerebral spinal fluid is produced in the ventricles of the brain and is then supposed to circulate out through the bottom of the brain and be reabsorbed in the subarachnoid space. So there are two mechanisms where this can malfunction. The most common congenital form of hydrocephalus is non-communicating. And this is where the cerebral spinal fluid is formed in the ventricles, but it can't get out of the ventricles. So here's a picture of non-communicating hydrocephalus. In a normal brain, the CSF is formed in the ventricles, comes out through the bottom, and circulates over the surface of the brain. In someone with non-communicating hydrocephalus, something is blocking the base of the ventricles here, and the ventricles just continue to expand and expand, ultimately pushing the cerebrum up against the inside of the skull, causing an increased intracranial pressure. That blockage of CSF could be caused by an inborn structural defect, by some kind of infection or hemorrhage, or it can even be caused by a tumor. In congenital hydrocephalus, it's usually one of these two factors. The other type of hydrocephalus we see is communicating. And this is where the cerebral spinal fluid leaves the ventricles appropriately, but for some reason it's not absorbed. So this is usually due to inflammation, infection, or blood surrounding the meninges. We'll talk more about this when we consider meningitis later. This communicating hydrocephalus is usually acquired instead of congenital. The signs and symptoms for hydrocephalus do depend on the age of the patient, because whether or not those sutures and fontanelles have fused greatly affect how the brain, the cranium, responds to that increase in cerebral spinal fluid. So first, let's consider congenital hydrocephalus, or the one that affects infants. Remember, their cranium will still be flexible and expandable because of the sutures and the fontanelles that are still in place. So we'll see an increase in head circumference, bulging fontanelle, distended scalp veins, and the sun-setting eyes. Along with that, we can see irritability, poor PO intake, or even vomiting, and a high-pitched cry. For older patients who may acquire hydrocephalus due to an infection or a tumor or something, there is no head enlargement or bulging fontanelles, but we do see headache, vomiting, especially after laying down. because laying down increases the intracranial pressure. We see poor PO intake, poor appetite. We can see cognitive or personality changes, ataxia, or lack of balance and coordination. And we can see visual changes, double vision, blurry vision, etc., and pupil changes. So I hope you recognize that these lists of symptoms exactly match the same lists of symptoms that you'll find in the increased intracranial pressure video. So if you understand increased intracranial pressure, then you will already know the signs and symptoms for hydrocephalus. The most common treatment for congenital hydrocephalus is called a VP shunt. That's ventriculoperitoneal shunt. So one end of the shunt starts in the ventricle, and then the tube connects all the way down into the peritoneum, where the fluid is reabsorbed through the lining of the peritoneum. Halfway down, there is a valve where the neurosurgeon can adjust just how much of that fluid is drained. Because if you drain too much, then the brain is actually too small and leads to its own set of signs and symptoms and complications. This valve is usually controlled by a magnet, so no further surgery is needed. However, VP shunts do come with their own complications. So if it's ever blocked, then of course the pressure inside the brain will rise quickly. There's also a high risk of infection, which can also cause blockage. So anytime a patient with VP shunt gets any kind of fever or vomiting, we need to consider the possibility that there may be a malfunction or an infection with that shunt. So it does require pretty careful monitoring throughout the patient's life. Because of that, it's not an ideal solution for hydrocephalus in communities that have limited access to health care, whether that's certain underserved areas in the United States or other countries that don't have the same level of health care. So there is an alternative. It's called the endoscopic third ventriculostomy. And whenever you see ostomy, you should think a surgical hole created in something. And if you translate the rest of the word, you can see it's a hole created in the ventricle, the third ventricle specifically. And it's done endoscopically, so they feed a tube up through blood vessels rather than having to actually open the cranium. The problem with this surgery is that if it's done too early in life, there's a risk that that hole created will just reclose. So it does need to be done a little later in life, or this procedure needs to be repeated as the hole recloses. But it is an alternative that neurosurgeons consider, and we're starting to see more and more of it, so we don't have to deal with the risks of infection and blockage that we see with the VP shunts. If you are caring for a patient who just had a VP shunt placed, this picture gives you some idea of some of the things you might see. So you'll notice that there are 2 incisions on the skull. This incision is where they actually entered the ventricles and introduced one end of the tube. And then this incision is where the valve or the reservoir is placed. And then there's another incision down on the abdomen where the other end of the tube was placed into the peritoneum, and it actually tunnels all the way through the skin, kind of up the back of the neck here. And you can sort of see there the tubing under the scalp. So it connects all the way down, bringing that excess fluid from the brain to the belly space. You can also see that there's a wide variety of monitoring equipment on this child. We have some cardiac and respiratory leads. We have plenty of IV tubing. And then some of this equipment up here ultimately goes off to a continuous intracranial pressure monitor. That usually stays in place for a day or two, sometimes even longer, just to allow the neurosurgeon to regulate the valve to make sure that the right amount of fluid is being drained. Also notice that the bed is just ever so slightly elevated and that there is no pillow. Again, those are typical nursing interventions. We want to be careful with how high the head of the bed is directly after surgery for a VP shunt because we don't want to drain too much fluid too fast. So we will go slowly, go carefully, and keep an eye on that ICP monitoring at the same time. A final thing to point out is just that this poor little guy seems to be bothered by the light, the activity in the room around him. So that's just another good reminder to keep the stimulation to a minimum and as much as possible allow the parents to provide care rather than the scary healthcare professionals providing the care. So that's hydrocephalus in a nutshell. Remember, for whatever reason, the cerebral spinal fluid cannot make it out of the brain and causes increased intracranial pressure. So the signs and symptoms are consistent with the general ICP symptoms that we already know. To manage hydrocephalus, we either look to a VP shunt or to that endoscopic third ventriculostomy procedure. After any kind of neurosurgery, of course, we're going to focus on careful monitoring of vital signs and neuro symptoms, and then, of course, watching for any sign of infection. As always, let me know if you have any questions. I'm happy to answer.